This morning, a woman heads to surgery to receive a new heart at one of the top heart transplant centers in the country. And Ken is inspired to take the mound less than 1 year after transplant. Interventional cardiac surgeons prepare to fix the tender heart of a 3-month-old boy. And 5-year-old Omari is heading to his first day of kindergarten, just like the rest of his classmates. This afternoon, farmers harvest vegetables from our hydroponic greenhouse, which yields more than 5,000 pounds of produce each year. And a high school senior named Luis is learning the nutritional value of baby kale. This evening, Lois is prepping for surgery to receive a double lung transplant. And Craig is accompanied by his guitar instead of an oxygen tank. All day, every day, Newark Beth Israel Medical Center and Children's Hospital of New Jersey are committed to providing world-class leading-edge medicine to every patient. A top teaching hospital offering state-of-the-art patient care and an anchor institution that thrives on empowering our neighbors and partnering with our communities to live healthier together. Newark Beth Israel Medical Center and Children's Hospital of New Jersey. Let's be healthy together.
Hello, good afternoon, everyone. I want to thank you all for joining us today, and I also want to thank our panelists for taking time out of their busy schedules. You know how busy it is during the middle of the day to participate in this webinar. So before we begin, I'll just do a brief introduction of everyone that we have with us today. We have Dr. Christina Migliore, our Medical Director of Quality and Director of Pulmonary Hypertension and Advanced Lung Disease Care. Thank you, Dr. Migliore, for joining us. We also have Dr. Johanny Garcia, our Division Director of Internal Medicine, and Dr. Dyese Taylor, who is a Maternal Fetal Medicine Specialist here at NBI and is also expecting a baby right now. Yay, congratulations. Dr. Taylor, I know we can't wait to hear your story, and you're going to tell us why you decided to get vaccinated. So that's exciting. And before we jump into that, we want to start with Dr. Migliore. Dr. Migliore, I know you've seen the worst of this disease really here at the hospital, especially during the height of this pandemic. And before we started today, you told me about a story that really impacted you and really speaks to the reason why we're doing this webinar today. Can you tell us about that?
Yes, thank you, Linda. So, we know COVID doesn't discriminate. Men, women, race, religion, it does not discriminate. However, women in general is such a big topic and so important to the panelists here that there's one case in particular. You've heard stories of families just being wiped out by COVID. We had a family of 4 that all were diagnosed with COVID, pneumonia. The 2 younger ones, the brother and the sister, did not have to get admitted, thankfully. But the mother and the father were both admitted to the intensive care unit. Both had to be put on ventilator breathing machines. The father we were able to take off, and he did fine, and we transferred him down to a low acuity floor. However, the mom didn't fare so well, and she wound up getting worse and worse, and she wound up dying. And out of the 4 people in that family, if you when we're talking to the family, they know that she was the pillar, she was the center, as most women are in families, whether they have children, don't have children, they are usually the pillar in the family. And that just, spoke to me, as a female and as a physician that, this family, they lost the one main person that kept them all together. And so I think it's important for us to bring this to the forefront, to know that as women, we tend to put ourselves last. It's just in our nature. And I think this is a great thing to bring in the forefront and do this webinar with these 2 other amazing physicians to talk about this, because as women, we talk with each other, but I think we kind of keep a lot of stuff to ourselves when we worry about everybody else. There is something, during the COVID response, I think women have the hugest economic impact because, over 1 million kids were out of school. and who's responsible for them. And women have full-time jobs, and we take care of the children, and it's our responsibility. They looked at, women have more average of working at home, unpaid. We just do that. And I found one statistic by the UN that I shared before that, in healthcare itself, 78% of hospital jobs are by women. And I'm not talking about doctors, nursing, everybody who plays a part, the important people for the cleaning and the nutrition and housekeeping. 78% of these jobs in the healthcare force are women. And to think that they're unable to work because they have other obligations. And COVID, we talk about acute COVID, but one of the big things that is coming up now is called long hauler syndrome. And I'm not sure if many of you have heard about this, but long hauler syndrome is a syndrome that affects patients who are diagnosed with COVID, and it does not matter how severe your COVID was. You could have had a mild case. But months down the line, you start to complain of things such as extreme fatigue, some mild shortness of breath, this brain fog, where you just can't concentrate. A lot of women are complaining of hair loss, anxiety, and some even have some PTSD. And when they looked at all the COVID, all patients who suffered from COVID, out of all the patients, about 10% are going to suffer from this long haulers, which doesn't seem like a lot, right? 10%. But also in that 10%, 80% of them are women. So it's a huge number, and it's going to affect now and going forward. And there's so much more that we don't know about this disease. So I think it's important to everybody out there, even if you suffered from COVID and it might have been a mild case and thankfully didn't be admitted and you just have sort of a cough and a shortness of breath, that down the line, this could happen. And that, we at the Beth have so many good resources, from our, post-critical care clinic, which we're seeing a lot of these long haul syndromes. And looking at that statistics where 80% of that 10% were women, looking at the patients that we see, all of a sudden it's like, yes, majority of them are women. And the women have to know that they're not alone, that it's not something that's in their head. And as women, sometimes we get dismissed. There is this gender bias that women get dismissed as it's overreacting, or you have a lot going on, or you have your family and that's why. But this is a real disease that's now lingering from COVID. And I think it's important that women have resources and reach out, even with the anxiety itself. I think it's an important aspect. And that's why I think prevention now is our #1 best medicine, and is the vaccination. And that as women, we have to be at the forefront, because women and families, healthcare, how families function and see physicians, it's usually the woman. So I think as women, we step up and we say, look, as women, we will get vaccinated to protect ourselves and our family. So I think that's important.
It's really important, Dr. Migliore. Thank you so much. That's amazing. A statistic, 80% of the long haulers are women.
Yeah.
And so many times when we're going around talking to women in our own facility, and I'm sure you see it, in your practices, that they're very much more concerned about taking care of their family and people around them, and maybe putting their own health last. So thank you so much for bringing that information to us. I want to remind everyone that if you have questions, please send the questions in the chat. The physicians are here to answer any questions that you have during the webinar. So please feel free to send those away, and we will try to answer them live during this session. One of the other questions that we get a lot when we're talking to employees is about pregnancy, trying to get pregnant. Should I get the vaccine? I am pregnant. What will it mean for the future? And I'm so glad that we have Dr. Dyese Taylor with us today, because Dr. Dyese Taylor, you are actually pregnant right now, 30 weeks, correct?
Yes, that's right.
Congratulations. And you did get the vaccine. So tell us, what all into your decision?
So, I mean, it was a hard decision to make. I think even though, I know the data and I think I'm okay at balancing risk versus benefits, it's different when you're actually pregnant. It's like your mind separates the academic part of you and like the emotional part of you that's attached to pregnancy. And so, I talked to some colleagues, I did my own research on previous mRNA vaccines, And I thought that it was pretty low risk in terms of having any fetal anomalies. I actually chose to get vaccinated in the first trimester, which I think many people get nervous about because the first trimester generally is an all or none effect. If something is going to happen, it will happen and be pretty significant versus other trimesters of pregnancy. And so I chose to get vaccinated because I thought I was pretty high risk for getting COVID. And I didn't also want to bring it home to my family. And also I didn't want to be very sick because I already have had patients who've unfortunately passed away from COVID, mostly postpartum patients. And, you know, it's very traumatizing to see very young patients who don't have significant comorbidities die who you take care of. And I think that really stuck with me. And I was not willing to continue to take a risk of getting COVID. And knowing what the outcomes are, that the outcomes are worse in pregnant patients compared to non-pregnant patients, I thought, you know, it would be safer for me to take the vaccine. Yes, we don't have information on very long-term data. We're not following kids 1 or 2 years because this pandemic's only really been going on for a little bit over a year, but just in terms of the safety profile from other mRNA vaccines, I felt comfortable taking the vaccination.
Wow. Well, we're glad that you did. We have a couple of questions in the chat, so I'll just get right to them. Is there any information on women who were positive during pregnancy? Is immunity passed on to the infant?
Yeah, so recently there's actually been some studies that have come out, and they actually show that compared to patients who've had COVID, the patients who've been vaccinated actually pass on higher levels of antibodies to their baby, to the neonates. So they tested babies of moms who got vaccinated versus moms who just were positive for COVID anytime during their pregnancy, and the level of antibodies was higher in the patients that actually got vaccinated.
Oh, nice. I have another question here. I am pro-vaccine, but now that the age criteria has expanded, I'm concerned about long-term effects for my 17-year-old daughter as she grows into womanhood. Any guidance that you can share? I guess I'll open that up for the entire team here. Giving the vaccine to a 16-year-old girl, are there any long-term effects, or what would you consider for?
I could answer that part. I think, well, what we know right now is that the Pfizer vaccine was tested in people as young as 16 years old. So it is actually recommended, it is approved for ages 16 and above. But the question of the long-term effects, or if there are any, is really a good one. And we just don't know if there are any long-term effects. I think what we can do, as Dr. Taylor said, is really think about the risk benefits of taking the vaccine. And that's really what the hard decision is. You know, what is the risk for your child, your 17-year-old, you know, young woman, of getting COVID versus not getting COVID? And when you're thinking about any kind of treatment, and especially a vaccine, right, because you don't feel sick, right? It's not like you're sick and you're taking an antibiotic and it's going to, you know, alleviate you. This is, you're putting money in the bank with a vaccine for later. You know, look at your 17-year-old and think about what her risks are. So what are the things that increase the risk of severe COVID disease? One is chronic diseases. So in addition to actually being pregnant, pregnancy also increases your risk of severe COVID disease, like Dr. Taylor said, but also things like asthma. And actually, people may not know this very much, but patients who are obese, people who are overweight, do poorly with COVID. It actually is one of the #1 risk factors for COVID, severe COVID disease. including heart disease, diabetes, kidney disease, a history of cancer. So really looking at your loved one and yourself and thinking, what is the risks of having severe COVID disease, severe that you would have to be hospitalized, with a high risk of getting very sick and even dying.
We have several questions coming in, so I want to make sure we get to all of them. Thank you, guys. Great conversation. Can a mother pass on antibodies to breastfeeding? You know, while she's breastfeeding, can she pass the antibodies on to her child?
So yeah, also a recent study that came out, they looked at the breast milk of moms, and they saw that there were antibodies that were being passed on through the breast milk of moms that were vaccinated. And also they tested the babies and saw that there were pretty high antibody levels being passed on. So we believe that that breast milk can pass on immunity to the baby.
So there seems to be, even though we don't know all of the long-term effects, we're already finding some positive effects of getting back.
Exactly.
There was a lot of talk about the mRNA vaccine interfering with fertility. And there are a lot of young women obviously trying to plan their families, concerned about this. What information do we have about fertility and the vaccine? Dr.
Yeah,
Taylor.
so from the data that we have, there doesn't seem to be an increased risk of having infertility from the vaccine. I think that's a big fear that has been addressed by multiple studies. Even, you know, in the Pfizer and Moderna trials, there were patients that went on to have babies who got vaccinated and have pregnancies. So just from the data we have so far, it doesn't seem there is an increased risk of infertility.
I have a question here about the long hauler symptoms. How far out are you expected to experience these symptoms? So for example, a year out, should I still have the long hauler symptoms a year out? Some days I feel like myself and other days I feel sick.
Yes, so again, you know, it's a new disease. So we're just about at, you know, we've just passed the 1-year mark for us here, you know, at our peak. And we still have seen patients that have had symptoms of the long hauler syndrome, and there is no reason for it. We cannot, literature has not come up with the reason that they have it or when it's going to go away or how long it could linger. I guess, you know, since it's such a new disease, I think just more time will tell. And it's not even connected with if they had a severe case or not, like we said before.
What can they do? How can they?
So I think that they should get checked out, you know, by their primary care doctor to make sure that they don't have any other underlying diseases, because we know a lot of things have gone unchecked during COVID due to the overwhelming on the healthcare system. So I think a lot of our health maintenance kind of fell behind because of everything that was going on in healthcare. So I think it's important to check with their primary care doctor to make sure that there's nothing else that could be going on with them medically.
That's a good point. If you have had COVID, and this is another question that comes up a lot, because unfortunately people, you know, the disease is still with us and people are still getting it. How long do you have to wait before you can get vaccinated? So if I had COVID in January or March, how long do I have to wait now before I can get the vaccine? I'll throw that out to any of you who might have the answer to that one.
Really, this is actually a really good question because I get this a lot in my practice.
It's one of the most popular questions.
Yeah, right.
Very good question.
First, if you had COVID, you still should, you're still eligible for the vaccine. That's first. Really, the recommendations by the CDC, what they say is, once you are fully recovered from COVID, then you're eligible for the vaccine again. The reason we want you to be recovered is because we want to make sure that if there's anything We know that we always want to check for reactions to vaccines, that it's not just a symptom of you recovering from COVID. So it really depends on the person. There's no real time, and it depends on, the severity of the COVID disease that you had. So my recommendation would be is check in with your primary care physician or, a trusted physician, and ask that question, because it doesn't. I think some people have asked me, well, I've read somewhere it's 3 months, but that's not true. I think it's actually 3 months that we think that the antibodies will last, at least the data that we have now. But of course, we're not sure how long the antibodies will last. It might be longer or shorter. So so you should still get the vaccine if you had COVID.
Okay. Now, is there a particular vaccine that you recommend? I think I know the answer to this one, but
No. No,
Yeah.
if you can get the vaccine, get any one you can.
yeah. And then because they all have pretty much similar efficacy, or what's the?
Yeah, so it's interesting because I get a lot of questions about, oh, what vaccine, they're offering me the Moderna, but I think I want the Pfizer. And when you think back to getting your flu shot, right? We never asked, well, who made this flu shot? I want to get the right one. And so, comparing the different efficacies and the different things of each vaccine is kind of like comparing apples and oranges, right? They do certain things, but they actually, studies have shown they actually even work better than the flu shot that we get every year. So I think it's important that, just if you can get the vaccine, please, if they're opening it up now, and this is going to be our way, to get back to, a more normal, so to speak, lifestyle now.
I have several questions about pregnancy now. Are pregnant women at increased risk of having a premature delivery if they have COVID?
Yeah, so some data is coming out that there is an increased risk for preterm delivery with COVID. Some of it is iatrogenic, honestly. It's not all spontaneous preterm delivery, but most of the data is showing that there is an increased risk from COVID.
Okay, I'm sorry, can you say that again? You said most of it is what?
Some of it is because it's iatrogenic. So basically the mom gets delivered by the doctor, not necessarily that they just go into labor. So whether it's, for more severe disease or whatever the cause, it could be, then you decide to deliver the patient. It's not necessarily because the patient goes into preterm labor always.
So it's not always a spontaneous.
Exactly. It's not always spontaneous, but even, the data that we have shows there is a slight increased risk for spontaneous delivery as well.
Have you personally seen any negative effects of a pregnant woman getting the COVID vaccine?
I personally have not. I got vaccinated, and the only thing I felt was, a little bit of arm pain for like a day. And then the people that I know that got vaccinated while they were pregnant, I haven't heard of anyone having any adverse outcomes. There is a data registry by the CDC called vSafe. They kind of, I think recently in the past couple of weeks, came out with some preliminary data, and they showed that there were no differences in, the side effects in pregnancy versus non-pregnant patients. Most people really complain about arm pain, maybe some headache, and a fever. And so in general, there is not more adverse side effects from the vaccine in pregnancy.
And just for those side effects, because I know we wanted to touch on this point, for women who are pregnant, who maybe if they do experience a fever, what's the recommendation for them to address that?
So if you have a fever after the vaccine, you can definitely take Tylenol, especially in low dosages and for like a short period of time. Tylenol is pretty safe in pregnancy. And then I know some people get concerned because there is some data about hyperthermia in the first trimester and possible risk of like neural tube defects. But in most of those previous studies, like the hyperthermia was for a prolonged period of time, mostly people who were using saunas or hot tubs, where the temperature gets very high and your core body temperature can go very high to like 102, 103. Those are like unsafe levels. And most patients aren't going to even have such a high grade temperature from the vaccine. But if they do, or they feel, really arm soreness that can't be tolerated, you can always take Tylenol.
Okay. Thank you. We have a question about antibodies. And do we know how long the antibodies remain in our bodies? For example, I had the vaccine in February. Would I have it for the remainder of the year? I know this is like a hot topic as well. Dr. Garcia, do you want to take that one?
Yeah, sure. That's such a good question. I think right now there are studies that are just reporting some data about people who took the vaccine and they're testing for the antibodies months later. And I believe the antibodies are still robust at 6 months. So that's pretty nice data to show that we are still protected even after 6 months post-vaccination. I do want to say a little something about vaccination. There is such a thing as fully vaccinated, which what that means if you're offered the vaccine that's 2 doses, you're fully vaccinated 2 weeks after the 2nd dose. And that's really when you get the full response of your immune system to the vaccine. The 1-dose vaccine, again, it's also 2 weeks after is when the full antibody response will be there. So, that is something nice to know, because once you're fully vaccinated, there are things that you can do that you couldn't when you were not vaccinated. Like, for example, you can sit at a table in a restaurant with your family or friends who are also vaccinated and not wear a mask. I know that seems like a little thing, but it's huge.
It's a step towards normalcy.
What?
It's a step towards normalcy.
It's a step towards normalcy.
You're sitting around a table with friends.
Yeah, you can, if you're fully vaccinated, you can also visit a household, one household, making sure that there's no high-risk person in that household. If they're not vaccinated, but you are, you can visit that household, which is, again, like a step, in trying to have some kind of connection with people. Like, as women, we really want that. And then the one last thing is, if you do have essential travel, New Jersey still does not recommend travel for non-essential purposes. But if you have a parent who's sick and you're vaccinated and you have to go see them, you're fully vaccinated, right? 2 weeks after the vaccine, you can travel and not have to quarantine after travel or get tested. So those are 3 things you can do if you get vaccinated. If that little plug for that.
Yeah.
I'm waiting for Thanksgiving. I can't wait.
Yes.
I can't wait. Is it safe to receive the COVID vaccine around the same time as you get another vaccine? So, for example, if you need to get your flu shot and then the COVID vaccine, can you do them same time? Should you put some space in between?
The recommendations are that you wait 2 weeks around the vaccine. So if you're gonna, let's say, get tetanus vaccine, if you're due for that and you want to get the COVID vaccine, recommendations is that you do wait 2 weeks, again, to make sure that any reactions that you may or may not get are just purely because of the COVID vaccine. We want to just isolate that time period, but that's really the only reason.
We have another question here about this long haulers. So lots of shortness of breath in folks after having COVID. Is there any rehab that could help or recommendations about activity levels?
Yes, so if you're having a significant amount of shortness of breath after you've had COVID, you definitely need to follow up with your primary care doctor, or again, follow up with, if you have a pulmonologist, or in our post-critical care illness clinic, and that should be looked at further, because what we do know, what's showing now after COVID, that there can be lingering lung diseases that we've only begun to touch on. They can still develop scarring of their lung afterwards. There's issues that affects the heart. So the shortness of breath can be due to various different effects of COVID. And so, before you would start any exercise regimen, once you've gotten checked out by your doctor, then you can discuss, an exercise program with them. And there are places that, will take and do things such as, an exercise for patients who have lung disease, like a pulmonary rehab program. But you should really first get checked out to make sure there's no underlying cause for it.
Thank you. Also, we have a question about the booster shot. Is there any truth to this, that you need a booster shot, or is the vaccine considered the more? Do you need a booster shot? Are we going to need a booster shot?
Mm. Well, you have some smart people out there asking good questions.
I know.
Yeah.
Yeah. So we don't know yet. I mean, I don't know if maybe Dr. Migliore, Dr. Taylor Dr. Taylor will chime in, but I think I think that question goes to the variants, right?
Mm-hmm.
So there are coronaviruses that are mutating right now, and that's a normal thing. All viruses do that. The flu virus does that, and that's why it's sort of like a booster in a way every year, because that's a tricky virus and it changes. And what we're seeing is that coronavirus, the current COVID-19 also is tending to change. I tell my patients that the flu vaccine puts on a new coat. They buy a new coat every winter, and we have to recognize that coat. So I think it might be a possibility. We'll have to see what happens. But currently, data shows that the 3 vaccines do protect us against severe COVID disease, even with the variants. So it's better to have the vaccine than not, even when there's a variant around.
Perfect. We're almost running up on time. We just have a few more questions I want to get to. Dr. Taylor, is there a recommendation to wait until the 2nd or 3rd trimester for pregnant women to receive the vaccine? And does that recommendation change if the woman already had COVID and has positive antibodies?
So there's no trimester specific time that's better to get the COVID vaccine, at least on the data that we have, whether you get it for 2nd or 3rd trimester, there doesn't seem to be really an effect in terms of difference in terms of adverse effects. And actually, the sooner you get it, the better, honestly. I would not wait necessarily for 2nd or 3rd trimester just because you're afraid of what could happen in the 1st trimester. Sorry, what was the second part of that question?
And then if you've already had COVID, do you still have the antibodies? Just go back up to that. It says if you've already had it, does the recommendation change? Like if you've already had COVID, should you take it?
Yeah, you still get vaccinated. You should still get vaccinated whether you had COVID or not. Just because, especially in pregnancy, there's such an increased risk for severe COVID disease. I mean, and I don't try to trivialize it because, as I said, no one really knows what the long-term data is for moms or babies, years on, because we just don't have that. It's only been a pandemic for a year, but I think you have to really think about what your risk is of getting COVID. Just on a personal note, like my husband got COVID 2 weeks ago, and he works from home. He would be considered one of the low-risk people to have gotten COVID. So we're pretty surprised when he got sick and tested positive. I was like shocked. But I was really happy that I got vaccinated because, I mean, talk about high risk. I would have definitely gotten it from my husband. And so, I mean, he fared well because he's young and healthy, but in terms of me, I was very, very, very happy that I made the decision to get vaccinated. I definitely think, yeah, you just don't know. I mean, technically he works from home, but we do live in a high prevalence state. And especially in the city that we live, it's pretty high prevalence. So, unsure how he got it, but he did get it, even though he works from home and doesn't really go anywhere. So I think even definition of how high risk you are, you have to really sit and think about that.
Yeah.
I mean, I think that brings up, back to families, what Dr. Migliore started us off with is really, COVID is almost like a disease that it's a family disease. It's one family member passing it on to a loved one, another loved one in your own family. And so looking at it that way, how you can make a difference in your family and your family's health is actually, it's beyond even your own health. It's also for your family, for the people you work with, for us, for our patients, and then for the community. So it's really a remarkable opportunity to help us all if one person gets vaccinated. The ripple effects are very broad.
Thank you. I want to thank you all. I just have one last question because we get so much of this from people who are concerned about the vaccine interacting with medications, and then also about can the vaccine trigger an asthma attack? So I'm going to turn it over, I guess, to Dr. Garcia for the last word on the asthma symptoms. Can the vaccine trigger asthma symptoms?
Sure, and I'll also defer to Dr. Migliore as a pulmonologist. Really, really, no, it's fine. It's
Vaccination expert.
I've learned so much from her, so I hope I get this right. So it's more the reactions to your immune system being triggered. So the fever, the low-grade fever, kind of achy. I mean, when I got the vaccine, I was like, oh my gosh, this is really, I felt it. It was different from another vaccine. I don't know if you guys did too.
Yes, I felt it, definitely.
Yeah. So, the most common side effects are fever, fatigue, low-grade fever, like 100, 99, body aches, feeling really tired, sort of like joint pain, shortness of breath, and triggering asthma I don't think are part of the most common side effects. Dr. Migliore, you can chime in on that part.
No, they haven't been shown to be. And, after you get the vaccine, it's not like they're going to give you the vaccine and let you go home. You're going to be monitored for a period of time. And usually, too, I've seen if, you said, I have a history of asthma, they will even watch you even closer for a longer period of time. Mm-hmm. But there hasn't been shown to be any kind of significant effect that if you have asthma, it's actually one of the reasons to get the vaccine. Mm-hmm. It's taking some empowerment against a disease that we felt so powerless against. Mm-hmm. And now this is our chance to have some, empowerment over it.
Thank you. I want to thank you ladies very much. This is a very informative webinar and very active and vibrant conversation.
Yes, great questions.
Really great questions. I hope that we answered a lot of them, and this webinar will be available on the bridge for all of our employees to see later today, and then it will also be available on our YouTube page so that you can share it, and we'll post it on our social media so that you can share it, so that everyone who's not an employee, because we do have people from the general public here listening today, so that you can watch it again as well. So I want to thank you again, and I also just want to encourage everyone that if you haven't received the vaccine, you can register to get vaccinated here at an RWJBarnabas health facility at Newark, Beth, Israel. If you go to rwjbh.org/COVID-19 vaccine, and if you are interested in getting vaccinated and need to find a local site in your area in New Jersey, you can go to covid19.nj.gov to find a local vaccination site in your area. We also just wanted to share some of the different high-risk conditions that place people at high risk for serious illness, and which also mean that you are available to get vaccinated. If you are over 16, you're currently eligible to get vaccinated right now if you have any one of the conditions listed here. So I don't know, we focus so much on age and, the expanding of the age, but there's a different criteria that you could be eligible to get vaccinated right now, even if you are, under 55 years old. And just to put it out there that by April 19th, in 2 weeks, it will be open pretty much to everyone 16 and over to get vaccinated. So, I hope this information has been informative for everyone who joined. I hope you learned something new today. And our doctors are available to you. You can definitely ask questions. Definitely go to nbivirtualcommunity.org and send in additional questions, and we'll hope to get those answered as well. And with that, I'll say goodbye for now, and hopefully we'll see you soon with additional webinars. Thank you very much.
Thank you.
Yeah.
Thank you.
Yeah.